All right, folks, next event here is a really, really important one. This is the Michael Jewett is going to be the recipient this year of the Nicholas J. Vogelzang Humanitarian Award. And my clicker is not working. So Dr. Jewett really is an exemplification of patient-directed clinical care and advocacy, and he's an incredibly worthy recipient of this award. He was trained in medicine at University of Kingston in Ontario, did his training in Canada and in the USA, and he just told me also that prior to this also was served as a stint in the Navy for a little while, sort of as a trainee. But moving on from there, he also has served in many different sort of supervisory and leadership roles, including the head of the Division of Urology, University of Toronto. His work really is exemplified by, once again, very patient-centric questions. How can we actually decrease the morbidity of the renal mass in the individual? And active surveillance of small renal masses really has been one of his passions, and he has leadership, tremendous leadership in this. When people came to visit Michael in Canada, he had this habit of giving people these honorary Canadian status. And you can see here we have a number of our friends who have visited over the years and have been bestowed this various status. But one of the things that he did fairly early on also was including the patient voice. So this is a picture from 2008, the first ever kidney cancer meeting in Mont-Tremblant, Quebec. And what was really innovative here was that there were 12 patients and caregivers in this meeting, and they had participated in voting and policy making and various other things. And this was actually really innovative 15 years ago. And a lot of the work that he's done more recently really has been focusing on shared decision making, the patient voice, and patient engagement in care. Michael became the chair of the IKCC and has, while involved in this, continued really pushing this agenda, meeting with individuals, and really being a champion for the patient voice in care for patients with renal cell carcinoma. He gave a talk in 2022 at the EAU. The title was Patient Engagement as a Potential Blockbuster Drug that Urologists Should Prescribe for Their Cancer Patient. Data that came from Ethan Bash showing that if you actually engage patients in their care, it improves their overall survival. Recently also, it's become apparent that this concept of patient engagement is not universal across every country, and he's been very focused on really expanding this to Asia, where we hope over the next few years that this is actually going to be something that's really going to start taking hold. For his work, Dr. Jewett was awarded the Order of Canada for his exceptional achievements in kidney cancer care and patient advocacy. This is kind of like a knighthood for Canadians. We are part of the Commonwealth in Canada. I say we because I'm Canadian as well. You can't be knighted in Canada, but you can get the Order of Canada, so I think maybe we can actually call him Sir Michael. He continues to really be a true advocate for patients, continues really in this mission of increasing the patient voice, increasing patient engagement in clinical care, and really is a leader in this field. So my take-home messages here are, Michael Jewett is a pioneer in evidence-based advocacy. He's worked tirelessly to promote shared decision-making in clinical practice, and patient engagement really is a powerful force that we really can use to improve our patients' outcomes. And we would do well to learn from Dr. Jewett.
thank you very much, Eric. That's probably the most creative introduction I've ever had in my career. Thank you. It's really a great honor to me to receive this award and to honor, in a way, Nick, who I knew. And I was thinking of an appropriate response to Nick's contribution. And I think every time I saw Nick in a corridor at a meeting or wherever I ran into him, he brought a smile to my face. He was just an enthusiastic, optimistic, energetic guy. And of course, we had in common this concern about our patients being engaged in their disease. And he followed on the heels of the breast and the prostate communities by establishing the Kidney Cancer Association in the, I guess, 1990 or so. And we followed his example in Canada, and I learned a lot from him. In this picture on the right, I also included an award he got from Chris Wood. And Chris and I were very friendly, and I understand his daughter Sarah is in the room at the back there. I invited him to that meeting at Mont Tremblant when we established what's now an annual research forum in Canada for kidney cancer, and it brings together all the communities involved in research. And I invited him and his wife, your mother, Sarah, came as well. And I'll tell just a brief anecdote, slightly off topic, but my wife, who is a clinician scientist and has been through the wars of science, as many of you have, after having dinner with Chris and his wife, said, "Boy, Chris is really a strong personality, isn't he?" And I thought, boy, coming from Brenda, that was really something. And of course, he went on to take over and really was an inflection point in the KCA. And it's such a strong meeting and association, and the things that Salvo went through today, it's just staggering. So it's a doubly great honor to not only be awarded the Nick Vogelzang Award, but also from the KCA. The previous awardees, two of which have been very active here at the meeting, Nazaire Tanir and Dan George, who you've heard many times asking very good questions, Bernard Scudier, who is not here this year, and to follow in these footsteps is really important. 6 years ago, I was awarded the Andrew Novak Award in the Miami meeting, and we both grew up in Montreal, and I was very closely to Andy for all those years, and we graduated in the same year, I believe, although he was at McGill. And Andy gave me the first insights into the natural history of small renal mass that led us to do biopsies and so forth, which was a bit of a research boutique for me, as you have heard. And to get now a humanitarian award for the patient activity with my clinical contribution is very meaningful to me. Finally, I want to recognize several people who are and were patients who have influenced me. And probably the earliest on the left was a woman named Diane Zapersky Colley, and she's half Canadian, and she started this BCAN organization that you may know about, and I was part of some of the early committees on this, and her husband John, who passed, and continues to live and work in the US, but she was a consummate advocate. She was one of these people who wasn't afraid to speak out. She wasn't intimidated by the professionals, healthcare professionals. She wasn't intimidated by the system, and she stood up and gave very thoughtful comments which really altered the care of bladder cancer patients. And her example was picked up by several people in Canada, and David Gutman on the right started Bladder Cancer Canada, which I helped facilitate. Simple things like getting a room in the medical center for them to meet, giving some lectures about, or educational sessions about kidney cancer, in that case bladder cancer. And then soon after, Kidney Cancer Canada did the same thing, and it was led by a woman that you see in the bottom right, Deb Maskins. Many of you know Deb. Deb's had kidney cancer for over 40 years. She was diagnosed at age 14. This is in the public record. She talks about it all the time. She was published as an upper tract urothelial adenocarcinoma, where in fact she was a variant RCC. And she's seen many of you in consultation. She continues to be a healthy, productive woman. And particularly these two women, made me realize how we can encourage our patients to make the enterprise better. And when I was asked to say and then of course I've become interested in the global side of it, and I've just recently finished the chairmanship of the board, and now Eric has taken over effective November 1st. And this is a group of almost 60 associations, of which KCA is the largest and really the jewel in the crown of our affiliated patient organizations, and we learn a lot from KCA as well. But to take these messages to areas of the world that are very disparate and shockingly disparate in terms of advocacy and patient engagement. So I chose the subject to give a short address, which I was invited to do, on improving cancer care outcomes through patient engagement and advocacy. And the word blockbuster was used just now by Eric, and I really feel we're in that zone. And the objectives that I would like to have in front of you are to better understand the importance of patient engagement and advocacy to improve kidney cancer care, and prompt you to think how you can foster this in your patients and their families, and to engage and become advocates, and to inform them about patient groups when they come to see you as part of the care package, to support those groups when asked, and maybe even encourage your patients to form a new group in your area or a chapter of an existing group. And lastly but not least, foster this, champion this with your colleagues and importantly your trainees and students. So the word patient engagement to me is really increasing awareness of the disease and to develop self-management competencies so that they really go through the whole care trajectory in a more effective and hopefully with a better outcome, and activate them to become very engaged in their kidney cancer care. And there are a number of interventions and activities which we've used as a template for a curriculum teaching on this subject at workshops, which I'll touch on at the end. Developing the health literacy component through educational materials. Patients have a unique perspective on this. Cultural, we have diasporas in all of our cities and our country, and we have to appeal to those diasporas to make this a more understandable thing. So it's not good enough to go to Tokyo and bring home the Japanese package. You have to translate that in a way that is culturally sensitive to North America, and conversely. Decision aids are increasingly, particularly with generative AI, going to play roles, and I don't know about your centers, but there are various aids online as we go through our patient care to help us to look at guidelines and so forth, and patients can bring their perspective to these guidelines. We now include patients in our guideline process, but from a patient perspective, a guideline is really a guardrail, and they can process the advice they get, the information that they see around them. Is it within the guardrails of the guidelines? So it's a very important thing for the discerning patient to have readable and relevant guidelines. Patient-reported outcomes, PROs, quality of life measures, patients should be involved in that process. We talked a little bit about research prioritization. We went through a process in Canada some years ago where we asked patients, as well as the science community and the clinical community, to talk about what are the priorities, and we set out 10 research priorities that were felt to be important, and the patients defined them with the science community. And it was quite interesting. We finally ordered it in a way that actually I never would have thought of, and that's important to align what we're doing, and we're not just off in our own little worlds without contact with the patients. We've talked about the involvement in clinical trial design, ethics review, and probably one thing that I felt we was emphasized today was that the recruitment of patients patients to trials can be enhanced dramatically by having the patients actively engaged in promoting, which means they need to know about the trials. And if you can capture that at the beginning when you're thinking of the trial, I think the momentum will just carry through when it comes to time of accrual. So this is a concept to me of co-production of kidney cancer care. It should improve the quality, and at the same time, the return on investment should be substantial. Costs will go down, which should more than pay for any costs involved in trying to engage patients in the system. So to play on the evidence basis that Eric was speaking about, that I feel it's very important when we're turning to our payors, our healthcare professionals, that we really provide evidence for our statements around the benefits of engaging patients and having advocacy as part of the activities in our cancer centers. So I think all of us would accept that the outcomes of things like emotional well-being, improved coping strategies, less fatigue. We heard about that earlier. There is evidence for this. Generally, the quality of life, ability to self-care. It starts to get into economic spaces too, though, when you look at compliance, taking medications, following up with appointments and investigations and so forth, is clearly improved amongst the informed, educated patients. Shorter lengths of stay in hospital is well documented. Lower rates coming back to emergency rooms, and interestingly, less medical legal action amongst patients who feel that they trust their physicians, that their healthcare team is talking in a way that they can understand. What really caught my eye, Eric just alluded to, now in Chapel Hill, Ethan Bosch wrote a research letter that was published in JAMA, presented it at ASCO in Chicago just before, looking at a secondary endpoint in a large trial of patients with metastatic cancers of all types who were on systemic therapy, and half of them were given an opportunity to report toxicities and other observations directly to a research nurse, an oncology nurse, which was acted on in real time rather than waiting till the next appointment. And the result of that is this graph, that this is overall survival going out to 8 years, and there was a statistically significant, a huge difference, which if this went to the FDA with a new agent, it would be no question this would be a blockbuster drug and would be approved. And this has been carried into some tools in France and parts of Europe, what is increasingly be called digital care. Patients are given an app when they start on systemic therapy, and it's being developed for surgical therapy as well, in which they can report each day, and that is seen by somebody in the team and acted upon. So this is now going through an HTA process and has been added to the French healthcare system. I want to end by just talking about my concept of advocacy. We think of it maybe too often as being the patients advocating for their various interests. But the other part of this is grass tops advocacy, and that's where you and I and Eric and others can really make a difference with the payors, the policymakers, and throughout the community of healthcare delivery. So I think you have a role in advocacy, even if you don't know it, and I don't think we are as effective as we could be. So I see it as a grassroots up, grass tops down, and together we're going to make the system better. And I spoke about the workshops that we've been running. We're planning up to 4 next year where we bring healthcare professionals together, and that's nurses, physicians, and talk about what I have touched on here. So the take-home message is patient engagement and advocacy improves the quality of care, reduces cost, and you can foster this understanding. You can help your patients to identify patient groups, support those groups, and champion this concept with your colleagues. Thank you very much for this great honor.